Okay, so this lady, she's 64-year-old and she presents with these fundus. This is a very classic presentation for high myopia. In fact, the myopia is so high that it causes disease of the retina. We call this pathological myopia or degenerative myopia. The first thing we get is actually the autorefraction. You see on the right eye, she's plus 150 with some seal, and on the other eye, she's minus 11. How is that possible? I mean, look at this. Minus 11, that makes sense, right?
Mm-hmm.
Plus 150, does this make sense? Oh, it doesn't. So how can you get such a myopic fundus with a plus 150?
LASIK.
There we go. So she got refractive surgeries. That's why I want you to see this, not to get fooled that one eye is minus. She didn't have surgery in this eye. She has a myopic eye. She did have surgery in that eye, and it fools us to make her think she's not myopic, but yes, she is. When you look at the eye, she is. Now, what do you see? This eye has a very classic myopic nerve. You see the nerve, instead of being like this, it's like this. You see the orientation is obliquely inserted. That's very classic for myopia. Now, you also have the fact that you can see through the retina because the retina is stretched. So you see the choroidal vessels really well. That's called tigroid fundus because it kind of like look like a tiger.
Yeah.
You see this thing? That's called a staphyloma. If you look at the eye, this is a dent. If you do an OCT of this area, you will have straight retina, it will go down, optic nerve, and it goes back up, and retina. So this is a dent just around the optic nerve. This is called a staphyloma. A staphyloma is a bulging backwards. You see that's a normal eye? That's just a longer myopic eye, but that's a longer myopic eye that got a staphyloma. You see that within that area of elongation, there is a dent. That dent, that's what we call staphyloma. In our case, it's just around the nerve. And you can see the macula is clear. We often look at the macula to make sure there is no disease of the macula. It's interesting because you can see that the difference of color, it shows you that the thinning is mostly posterior. In fact, you can see that there is another staphyloma. You see here?
Oh, yeah.
You see this thing? This area specifically in the eye is bulging exactly like this. So you have the overall elongation and you have more elongation specifically in that area. So you can see by the difference in color. This area is more stretched. That's why you can see through better. This is more of a normal retina. Of course, you make sure that there are no tears in the periphery, right? Because she's highly myopic, you can have tears.